Hi there! Preparing for D450. OA exam can feel overwhelming, but it doesn't have to be. Stick with us and we're going to help you with it. Our website has D450 OA questions and answers, and it won't cost you a thing. OA exams are tough, so everything from guides to practice questions is free. In this video, we will cover questions from prevention levels, community assessment, epidemiology basics, health education, program evaluation. So, let's get started.
1. A school nurse teaches a group of healthy 5th graders about proper hand-washing techniques during flu season to keep them from getting sick. Based on the target population and the goal of this intervention, which level of prevention best describes this activity? A. Health promotion education. B. Tertiary rehabilitation. C. Primary prevention. D. Secondary screening. What do you think is the answer? Correct answer, C. Primary prevention. Explanation? Option C is correct because the students are healthy with no identified illness or risk factor, and the goal is keeping them well, which defines primary prevention activity. Option A is incorrect because while health promotion education is an activity within primary prevention, it is not itself a level of prevention and does not classify the intervention properly. Option B is incorrect because tertiary rehabilitation applies to individuals who already have an established disease or condition and need help preventing further complications or disability from it. Option D is incorrect because secondary screening targets populations with identified risk factors to detect disease early, but these healthy students have no identified risk requiring early detection. Alright, let's get into the concept that shows up more than almost anything else on this exam: levels of prevention. The question here is about a school nurse teaching healthy 5th graders how to wash their hands during flu season. No one in this group is sick. No one has a risk factor. They're just regular healthy kids, and the nurse wants to keep them that way. That's the textbook definition of primary prevention. Primary prevention happens before any disease develops. You're acting on a healthy population to stop illness from ever starting. Immunisations, seatbelt campaigns, nutrition education for people who aren't sick. All primary. Now, option A says health promotion education. That sounds reasonable, but health promotion education is an activity you do within primary prevention. It's not a level of prevention itself. The question asks for the level, not the activity. Option B, tertiary rehabilitation, is for people who already have a disease and need help preventing complications. Think cardiac rehab after a heart attack. These kids don't have the flu. Option D, secondary screening, is about catching disease early in people who carry risk factors. These students are healthy with no identified risk. Here's a WGU D450 OA exam tip for you. When the question describes a healthy group with no disease and no risk factors, the answer is always primary prevention. Quick recall hook: healthy plus no risk equals primary. 2. A nurse organises blood glucose testing for overweight adults at a community health fair because this group carries elevated risk for developing diabetes. Considering the risk status of the target population, which level of prevention does this screening program represent? A. Secondary prevention. B. Primary prevention. C. Tertiary prevention. D. Community health promotion. What do you think is the answer? Correct answer, A. Secondary prevention. Explanation: option A is correct because the population has an identified risk factor of being overweight, and screening aims to detect disease early before symptoms appear, which defines secondary prevention. Option B is incorrect because primary prevention targets healthy populations with no identified risk factors, but this group already carries the defined risk factor of being overweight for diabetes. Option C is incorrect because tertiary prevention involves rehabilitation and complication management for people who already have an established diagnosis. not screening for early disease detection in at-risk groups. Option D is incorrect because community health promotion describes a broad strategy rather than a specific level of prevention, and it does not accurately classify a targeted screening intervention for at-risk individuals. Now let's look at the flip side. What happens when the population isn't healthy anymore but has an identified risk factor? This question describes a nurse organising blood glucose testing for overweight adults at a community health fair. These adults aren't diagnosed with diabetes yet, but they carry a defined risk factor. They're overweight. That puts them in the at-risk category. Screening this group for early disease detection is secondary prevention. Secondary prevention targets people who have a known risk factor, and its hallmark activity is screening. You're trying to catch disease before symptoms show up, when there's still a better chance of controlling or curing it. Mammograms, blood pressure checks for people with family history, tuberculin skin tests, all secondary. Option B says primary prevention, but primary is for healthy populations with no identified risk. These people already carry the risk factor of being overweight. Option C, tertiary prevention, applies to people who already have the diagnosis and need rehab or complication management. These adults don't have diabetes yet. Option D, community health promotion, is a broad strategy label, not a specific prevention level. Here's a WGU D450 OA exam tip for you. The word screening in a question almost always points to secondary prevention. Quick recall hook: risk factor plus screening equals secondary. 3. A public health nurse provides foot care education to a group of patients already diagnosed with diabetes to help them prevent ulcers and amputations. Based on the health status of this population, which prevention level applies to this educational intervention? A. Primary prevention. B. Secondary prevention. C. Health maintenance education. D. Tertiary prevention. Do you know the answer? Correct answer: D. Tertiary prevention. Explanation: Option D is correct because the population already has an established disease diagnosis of diabetes, and the education aims to prevent further complications, which is the defining characteristic of tertiary prevention. Option A is incorrect because primary prevention targets healthy populations before any disease develops, but these patients have already been diagnosed with diabetes and are managing an existing chronic condition. Option B is incorrect because secondary prevention focuses on early detection through screening in at-risk populations, not on managing complications for people who already have a confirmed disease diagnosis. Option C is incorrect because health maintenance education is not a recognised level of prevention in the standard framework, and it does not properly classify this intervention for an already diagnosed population. This is a critical concept for the exam, so pay close attention. The question describes a nurse providing foot care education to patients who already have diabetes. They've been diagnosed, the disease is established. The education aims to stop further complications, like ulcers and amputations. That's tertiary prevention. Tertiary prevention is about rehabilitation, complication management, and health monitoring for people who already carry a diagnosis. Physical therapy after a stroke, exercise programs for obese individuals, cardiac rehab, all tertiary. The population already has the condition, and you're trying to limit additional damage. Option A, primary prevention, targets healthy populations before any disease develops. These patients already have diabetes. Option B, secondary prevention, focuses on early detection through screening for at-risk populations. These patients are past the screening stage. They have a confirmed diagnosis. Option C, health maintenance education, is not a recognised level of prevention in the standard framework. It doesn't exist as a classification category. Here's a WGU D450 OA exam tip for you. If the population in the question already has a diagnosed disease, the intervention is tertiary prevention every time. Quick recall hook: Diagnosed plus prevent complications equals tertiary. 4. A kindergarten class receives hand-washing education during flu season, but a few children in the group have already recovered from influenza this year. The nurse must assign one prevention level to this entire intervention. Which classification principle should guide the nurse? A. Classify based on the sickest individuals. B. Match the predominant group status. C. Split levels for different subgroups. D. Default to tertiary for mixed groups. Can you guess the answer? Correct answer, B. Match the predominant group status. Explanation. Option B is correct because when classifying an intervention, the level of prevention matches the predominant health status of the entire group, not individual members within that group. Option A is incorrect because classification does not default to the sickest individuals in the group, as the level is determined by the majority health status of the entire population receiving the intervention. Option C is incorrect because a single intervention receives only one prevention level classification for the whole group, and splitting the classification across different subgroups violates this core principle. Option D is incorrect because there is no default rule assigning tertiary prevention to mixed groups, as the classification must reflect the predominant health status of the majority of the target population. This one catches a lot of students off guard, so let's nail the concept right now. A kindergarten class gets hand-washing education during flu season. Most kids are healthy, but a few have already recovered from influenza. The nurse needs to assign one prevention level to the entire intervention. The answer is match the predominant group status. You do not split a single intervention into different levels for different people within the group. One intervention gets one classification. Period. The way you determine that single level is by looking at the majority of the group. Most of these kids are at risk for flu, but don't have it. So the intervention is classified based on that majority status. Option A says classify based on the sickest individuals. That's wrong. You don't default to the worst case members. Option C says split levels for different subgroups. That directly violates the one level per intervention rule. Option D says default to tertiary for mixed groups. There is no such default rule. The classification always reflects the predominant status of the group. Here's a WGU D450 OA exam tip for you. Whenever a question describes a mixed group receiving one intervention, remember the rule: one intervention, one level based on the majority. Quick recall hook: one intervention equals one level equals majority rules. 5. A community nurse is planning an educational session about sun protection for a group of outdoor workers who have no history of skin cancer or identified risk factors. The nurse wants to classify this intervention correctly. Which prevention level best fits this healthy population scenario? A. Primary prevention. B. Tertiary prevention. C. Secondary screening. D. Rehabilitative prevention. What do you think is the answer? Correct answer, A. Primary prevention. Explanation. Option A is correct, because the outdoor workers are healthy with no disease history or identified risk factors, and education aimed at keeping a healthy population well is classified as primary prevention. Option B is incorrect because tertiary prevention applies only to populations that already have an established disease or condition, requiring rehabilitation or complication prevention, which does not describe these healthy workers. Option C is incorrect because secondary screening targets populations with identified risk factors to catch disease early, but these workers have no identified risk factors or history requiring early detection efforts. Option D is incorrect because rehabilitative prevention is another term for tertiary level intervention that applies to people recovering from illness or managing existing conditions, not to a healthy working population. Let's reinforce what we just covered with another angle on primary prevention. This question describes a nurse planning sun protection, education for outdoor workers. These workers have no history of skin cancer, no identified risk factors. They're healthy. The nurse wants to educate them to keep them that way. That's primary prevention. Acting on a healthy population before disease develops. Option B, tertiary prevention, only applies when someone already has an established condition. These workers are healthy. Option C, secondary screening, requires an identified risk factor and involves detecting disease early. No risk factors are identified here. Option D, rehabilitative prevention, is just another way of saying tertiary. It's for people recovering from illness or managing existing conditions. Here's a WGU D450 OA exam tip for you. Look for the phrase no history of disease and no identified risk factors in the question stem. Those keywords point straight to primary prevention. Quick recall hook. No history plus no risk equals primary. 6. A public health nurse collects data on childhood vaccination rates by interviewing community leaders and reviewing county health records to understand which neighbourhoods have the lowest immunisation coverage. Based on the nature of this activity, which core function of public health is the nurse performing? A. Policy development. B. Community organising. C. Assurance. D. Assessment. Can you guess the answer? Correct answer, D. Assessment. Explanation. Option D is correct because the nurse is systematically collecting, organising, and interpreting health data about the population, which is the defining activity of the assessment core function of public health. Option A is incorrect because policy development involves creating rules, guidelines, or programs based on data that has already been collected, not the actual process of gathering and analysing that data. Option B is incorrect because community organising is a specific public health intervention that helps communities mobilise resources to solve problems, not one of the three recognised core functions of public health. Option C is incorrect because assurance means ensuring that essential health services are actually available and accessible to the population, not collecting data to understand health problems in the first place. Now we're switching gears to the three core functions of public health, which the Institute of Medicine defined. This is another topic the exam hits hard. The question describes a nurse collecting vaccination rate data by interviewing community leaders and reviewing county health records. She's gathering information. She's organising and interpreting data. That is the assessment function. Assessment is all about systematic data collection about the population. Interviewing key informants, analysing existing data sets, reviewing records, all assessment activities. Option A, policy development, comes after you have data. It's about creating rules, guidelines, or programs based on what the data shows. The nurse here hasn't gotten to that stage yet. Option B, community organising, is one of the 18 public health interventions. It's not one of the three core functions at all. Different category entirely. Option C, assurance, means making sure essential health services actually reach people. The nurse isn't delivering services, she's collecting data. Here's a WGU D450 OA exam tip for you. If the nurse is collecting, reviewing, or analysing data, that is assessment. Full stop. Quick recall hook. Collecting data equals assessment. 7. After reviewing data showing rising sexually transmitted disease rates among young adults, a health department creates a new programme to distribute free condoms at local colleges and community centres across the county. Which core function of public health does this action best represent? A. Assessment. B. Policy development. C. Assurance. D. Surveillance. What do you think is the answer? Correct answer, B. Policy development. Explanation. Option B is correct because the health department is using scientific data to create a new programme and guidelines that address a population health problem, which defines the policy development core function. Option A is incorrect because assessment involves the collection and analysis of data about health problems, but the data has already been reviewed and the department is now acting on it. Option C is incorrect because assurance focuses on making sure that services actually reach the people who need them, not on the initial creation of programs or policies based on collected data. Option D is incorrect because surveillance is one of the 18 public health interventions, involving ongoing data collection and monitoring, not one of the 3 core functions identified by the Institute of Medicine. Here's a scenario that flows naturally from assessment into the next core function. A health department reviews data showing rising STD rates among young adults, and then creates a free condom distribution program at local colleges. The data was already collected. That part is done. Now the department is acting on the data by designing a new program. That's policy development. Policy development means using scientific knowledge to create rules, guidelines, or programs that address population health problems. Option A, assessment, is the data collection phase. That already happened. The data was reviewed, not being gathered for the first time. Option C, assurance, is about making sure services actually reach people who need them. The program hasn't been rolled out yet. We're still at the creation stage. Option D, surveillance, is one of the 18 public health interventions involving ongoing data monitoring. It's not one of the 3 core functions identified by the Institute of Medicine. Here's a WGU D450 OA exam tip for you. When a question shows data leading to a new program or policy, that transition from data to action is policy development. Quick recall hook: data leads to action equals policy development. 8. A nurse discovers that a local factory lacks any on-site occupational health services, despite workers facing chemical exposure hazards daily. The nurse works with administrators to establish a health clinic inside the factory. Which core function does this effort best represent? A, assurance. B, assessment. C, policy development. D, health planning. What do you think is the answer? Correct answer, A, assurance. Explanation: option A is correct because the nurse is making certain that essential health services are actually available and accessible to the workers who need them, which is the defining characteristic of the assurance function. Option B is incorrect because assessment involves collecting and analysing data about health status and problems, but the nurse has already identified the gap and is now taking action to fill it. Option C is incorrect because policy development means creating rules, guidelines, or programs based on scientific evidence, not the direct follow-through of establishing access to needed health services on location. Option D is incorrect because health planning is a specific nursing role involving the development of health services for at-risk populations, not one of the 3 core functions of public health identified by experts. Now let's complete the trio with assurance. A nurse discovers a local factory has no on-site health services even though workers face daily chemical exposure. The nurse works with administrators to establish a health clinic inside the factory. The problem was already identified. No data collection happening here. No new policy is being written. What the nurse is doing is making certain that essential health services are actually available and accessible. That's assurance. Assurance is the follow-through. It's the function that gets services in place after assessment finds the gap, and policy development designs the solution. Option B, assessment, involves collecting and analysing data. The nurse already knows the gap exists and is acting on it. Option C, policy development, is about creating rules or programs. The nurse is past that stage. She's implementing access to services. Option D, health planning, is a specific nursing role, not one of the 3 core functions. Here's a WGU D450 OA exam tip for you. When the nurse is making sure services actually get to the people who need them, that's assurance. Quick recall hook: services delivered equals assurance. 9. A community health nurse interviews key informants, reviews hospital discharge data, and conducts a windshield survey to create a comprehensive picture of neighbourhood health issues. She then presents findings at a town meeting. Which sequence of core functions does this scenario best demonstrate? A. Assurance, then policy development. B. Policy development, then assurance. C. Assessment followed by policy development. D. Assurance followed by assessment. Can you guess the answer? Correct answer. C. Assessment followed by policy development. Explanation. Option C is correct because collecting data through interviews, records, and observation is assessment, and presenting findings to inform community action moves toward policy development as the logical next step. Option A is incorrect because assurance involves ensuring services reach people, which is not what occurred first in this scenario where the nurse began by collecting and analysing community health data. Option B is incorrect because policy development cannot come first when no data has been collected yet, and assurance would follow only after policies and programmes have been established for delivery of services. Option D is incorrect because the scenario begins with data collection activities like interviews, record review, and windshield surveys, which clearly represent assessment rather than assurance as the starting point. This question tests whether you can recognise core functions happening in sequence. A nurse interviews key informants, reviews hospital discharge data, conducts a windshield survey, and then presents findings at a town meeting. The first part, interviews, data review, windshield survey, is clearly data collection. That's assessment. The second part, presenting findings at a town meeting to inform community action, moves toward policy development because you're using the collected data to shape what happens next. So the correct sequence is assessment followed by policy development. Option A says assurance then policy development. Assurance is about delivering services, which isn't happening first here. The nurse starts by collecting data. Option B says policy development then assurance. Policy can't come first when no data has been collected yet. Option D says assurance followed by assessment. The scenario clearly starts with data collection activities, not service delivery. Here's a WGU D450 OA exam tip for you. When a scenario walks through a sequence, identify each activity separately. Data collection equals assessment. Using data to drive action equals policy development. Delivering services equals assurance. Quick recall hook. Collect then act equals assessment, then policy development. 10. A county health department reviews its 10 essential public health services and realises it has failed to enforce existing food safety regulations at local restaurants. Restaurant inspections have been delayed for over a year. Which core function has the department neglected in this situation? A. Assessment. B. Policy development. C. Community organising. D. Assurance. What do you think is the answer? Assurance. Correct answer, D. Assurance. Explanation. Option D is correct because the department has failed to make certain that essential public health protections are actually being delivered, and enforcing existing regulations falls under the assurance function of public health. Option A is incorrect because assessment involves collecting and analysing data about population health status, not enforcing regulations that have already been established to protect community health and safety. Option B is incorrect because the food safety regulations already exist as established policy, so the failure is not in creating policy, but in ensuring those existing policies are actually carried out effectively. Option C is incorrect because community organising is a specific public health intervention that helps residents mobilise around shared problems, not one of the 3 core functions the department is evaluated against. Let's flip the perspective. Instead of identifying which function a nurse is performing, this question asks which function a health department has neglected. The scenario describes a county health department that has failed to enforce food safety regulations at local restaurants. Inspections are over a year behind. The food safety regulations already exist. The policy was already developed. What's missing is the follow-through, making sure those regulations are actually being enforced and that services protect the public. That's assurance. The department failed in its assurance function. Option A, assessment, is about collecting data on health status. The problem here isn't a lack of data collection. It's a failure to act on existing rules. Option B, policy development, already happened. The food safety regulations were already created. The failure isn't in making policy. Option C, community organising, is one of the 18 public health interventions, not one of the 3 core functions. Wrong category. Here's a WGU D450 OA exam tip for you. When existing policies or services aren't being carried out, the failing function is assurance. Quick recall hook. Policy exists but not enforced equals assurance failure. 11. A public health nurse is beginning a community assessment and needs to understand the demographics, diversity, and cultural identity of the people living in the area before examining anything else. Which component of the community should the nurse prioritise first in this initial assessment phase? A. People. B. Social systems. C. Boundaries. D. Environment. Can you guess the answer? Correct answer, A. People. Explanation. Option A is correct because the people component is considered the most important element of a community, and cultural identity resides within the people, making it the essential starting point for assessment. Option B is incorrect because social systems describe what resources are available in a community such as hospitals, schools, and government, but understanding the people must come before evaluating the systems that serve them. Option C is incorrect because boundaries define the geographic or conceptual limits of a community, which provides useful context but does not address the demographics and cultural identity the nurse needs to assess first. Option D is incorrect because the environment includes physical and sociocultural factors like housing and climate, but it does not capture the population demographics and cultural identity that the nurse is prioritising here. We're shifting into community assessment now. This question asks which component of a community the nurse should prioritise first when starting an assessment. The nurse wants to understand demographics, diversity, and cultural identity. The answer is people. People are considered the most important component of a community. Cultural identity resides in the people. You have to understand who lives there before you can make sense of anything else. The systems, the environment, the boundaries, the goals. Option B, social systems, describes what's available in a community like hospitals, schools, and government. You need to know who the people are before evaluating the systems that serve them. Option C, boundaries, define where the community starts and ends. Useful context, but it doesn't answer the question about demographics and cultural identity. Option D, environment, covers physical and sociocultural factors like housing and climate. Important, but not the starting point when the nurse's first priority is understanding the people themselves. Here's a WGU D450 OA exam tip for you. Whenever a question asks about the most important or first component in community assessment, the answer is people. Quick recall hook, people first always. 12. After completing a windshield survey of a low-income neighbourhood, a nurse documents observations of deteriorating housing, closed businesses, and limited sidewalks. To objectively validate these subjective observations, which additional data source should the nurse seek out next? A. Another windshield survey route. B. Informant interviews with residents. C. Morbidity and mortality statistics. D. Participant observation at a park. Do you know the answer? Correct answer. C. Morbidity and mortality statistics. Explanation. Option C is correct because a windshield survey provides subjective observation data, and objective validation requires measurable, quantitative statistics such as morbidity and mortality rates from reliable public health sources. Option A is incorrect because conducting another windshield survey simply adds more subjective observation data and does not provide the objective, quantitative validation needed to confirm the initial findings from the first survey. Option B is incorrect because informant interviews are another form of primary qualitative data collection that provides subjective perspectives, not the objective measurable statistics needed to validate the windshield survey observations. Option D is incorrect because participant observation is a primary data collection method that gathers subjective qualitative information by watching behaviours in natural settings, which cannot objectively validate prior subjective findings. This question comes up frequently, and it tests a specific rule. A nurse completes a windshield survey and documents deteriorating housing, closed businesses and limited sidewalks. The question asks how to objectively validate those subjective observations. The answer is morbidity and mortality statistics. A windshield survey is subjective. It's what the nurse sees while driving through the community. To validate subjective observations, you need objective, measurable, quantitative data. Morbidity and mortality rates from reliable public health sources give you that. Option A says do another windshield survey route. That's just adding more subjective data on top of subjective data. It doesn't validate anything objectively. Option B says informant interviews with residents. Interviews are qualitative primary data. They're still subjective perspectives, not measurable statistics. Option D says participant observation at a park. That's another primary qualitative method, watching behaviours in natural settings. Still subjective. Here's a WGU D450 OA exam tip for you. To validate a windshield survey, always look for the answer that provides hard numbers, morbidity and mortality data. Quick recall hook, subjective survey needs objective stats. 13. A nurse needs to write a community health diagnosis after identifying that many school-aged children in the county are suffering head injuries while riding bicycles without helmets. Which diagnostic statement format correctly captures this community-level health problem? A. Increased head injuries due to cycling. B. Risk of head injury among school-aged children related to lack of helmet use. C. School children need better helmets. D. Bicycle safety is a community concern. What do you think is the answer? Correct answer, B. Risk of head injury among school-aged children related to lack of helmet use. Explanation. Option B is correct because the community health diagnosis format requires 3 parts: the risk or problem, the affected population identified with among, and the contributing factor identified with related to. Option A is incorrect because it only names the problem and a general cause without identifying the specific affected population or using the required community health diagnosis format with among and related to components. Option C is incorrect because it is a vague recommendation rather than a structured community health diagnosis, and it fails to follow the required format that identifies the risk, population, and contributing factor. Option D is incorrect because it is a general opinion statement about community priorities that lacks the structured diagnostic format identifying the specific risk, the defined population, and the related contributing factor. Community health diagnoses follow a very specific format, and this question tests whether you know it. The nurse has identified that many school-aged children are getting head injuries while riding bikes without helmets. The correct diagnostic statement is risk of head injury among school-aged children related to lack of helmet use. 3 parts. Risk of identifies the problem. Among identifies the affected population. Related to identifies the contributing factor. That's the formula. Option A, increased head injuries due to cycling, names the problem and a vague cause but never identifies the specific population. It misses the among and related to structure entirely. Option C, school children need better helmets, is a recommendation, not a diagnosis. It doesn't follow any diagnostic format. Option D, bicycle safety is a community concern, is an opinion statement. No structured format, no specific population, no contributing factor. Here's a WGU D450 OA exam tip for you. Community health diagnoses always follow 3 parts. Risk of the problem among the population related to the factor. If an answer option is missing any of those 3 pieces, it's wrong. Quick recall hook. Risk of, among, related to. 14. A nurse reviews census reports, hospital discharge data, and state health survey results to build a community profile. She then interviews local church leaders and observes families at a neighbourhood playground. Which combination of data types has the nurse used in her assessment? A. Only primary data sources. B. Only secondary data sources. C. Only composite database sources. D. Both secondary and primary data. Can you guess the answer? Correct answer, D. Both secondary and primary data. Explanation. Option D is correct because census reports, hospital data, and health surveys are secondary gathered data, while informant interviews and participant observation are primary generated data, combining both types effectively. Option A is incorrect because census reports, hospital discharge data, and state health surveys are all secondary data sources that already exist, and classifying them as primary data would be an incorrect categorization. Option B is incorrect because the informant interviews with church leaders and the participant observation at the playground are both primary data collection methods that generate new information directly from the community. Option C is incorrect because composite databases combine multiple existing data sources into one, but the nurse used distinct individual sources and direct observation methods rather than a single, merged composite database system. Data collection types show up on the exam more than you'd expect, so let's get this one locked down. The nurse in this question reviews census reports, hospital discharge data, and state health survey results. Then she interviews local church leaders and observes families at a playground. She's used both secondary and primary data. Census reports, hospital discharge data, and health surveys already exist. They were gathered by someone else. That makes them secondary data, also called gathered data. The church leader interviews and playground observation are new information the nurse generated herself. That makes them primary data, also called generated data. Option A says only primary. Wrong Isam census data and hospital records aren't something the nurse created. Option B says only secondary. Wrong, the interviews and observation are first-hand data collection. Option C says only composite databases. A composite database combines multiple sources into one. That's not what happened here. The nurse used individual, separate sources. Here's a WGU D450 OA exam tip for you. If data already existed before the nurse touched it, it's secondary. If the nurse had to go out and collect it herself, it's primary. Quick recall hook. Already exists equals secondary. Nurse collects equals primary. 15. A community has legally defined city limits that separate it from the neighbouring county. But residents also recognise an unofficial arts district, known by reputation and cultural activity. Which types of community boundaries does this scenario illustrate together? A. Geopolitical and conceptual boundaries. B. Only geopolitical boundaries. C. Only conceptual boundaries. D. Functional and demographic boundaries. What do you think is the answer? Correct answer, A. Geopolitical and conceptual boundaries. Explanation. Option A is correct, because legally defined city limits are geopolitical boundaries established by law, while the unofficial arts district recognised by reputation represents a conceptual boundary perceived by the community socially. Option B is incorrect because while the city limits are indeed geopolitical boundaries, the scenario also describes an unofficial arts district that is socially perceived, which represents a conceptual boundary, not a legal one. Option C is incorrect because while the arts district represents a conceptual boundary, the scenario also clearly describes legally defined city limits, which are geopolitical boundaries established through formal, legal and political processes. Option D is incorrect because functional and demographic boundaries are not the two recognised boundary types in community assessment, which specifically distinguishes between geopolitical boundaries defined by law and conceptual boundaries defined socially. Community boundaries are one of those concepts that seems simple, but trips people up when both types show up in one scenario. This question describes a community with legally defined city limits and an unofficial arts district known by reputation. The city limits are geopolitical boundaries, drawn by law, established through political processes. The arts district is a conceptual boundary. It exists because people perceive it and recognise it socially, not because anyone drew a legal line. So you've got both types present. Option B says only geopolitical. It ignores the arts district, which is clearly conceptual. Option C says only conceptual. It ignores the city limits, which are legally defined. Option D says functional and demographic boundaries. Those are not the two recognised boundary types in community assessment. The framework specifically distinguishes between geopolitical and conceptual. Here's a WGU D450 OA exam tip for you. Geopolitical boundaries are drawn by law. Conceptual boundaries are drawn by perception. If a scenario has both, the answer includes both. Quick recall hook: law equals geopolitical, reputation equals conceptual. 16. A nurse works at a community health centre, providing wound care, medication management, and chronic disease monitoring to individual patients and their families in their homes. The nurse focuses on treating specific health problems outside the hospital. Which nursing practice area best describes this role? A. Population-focused nursing. B. Community-oriented nursing. C. Community-based nursing. D. Public health nursing. Do you know the answer? Correct answer: C. Community-based nursing. Explanation: Option C is correct because community-based nursing focuses on providing direct acute and chronic illness care to individuals and families outside hospital settings, which matches this nurse's described clinical activities. Option A is incorrect because population-focused nursing targets entire populations through broad health status assessment and addresses determinants of health at a population level rather than providing individual clinical care. Option B is incorrect because community-oriented nursing shifts focus from individuals to the broader community or population, aiming to preserve and protect overall community health rather than treating specific patient conditions. Option D is incorrect because public health nursing is a population-focused discipline that works to promote health and prevent disease for entire populations, not primarily to deliver direct clinical care to individual patients. Now we're moving into the 3 nursing practice areas, and you need to know the differences cold. This question describes a nurse providing wound care, medication management, and chronic disease monitoring to individual patients and families in their homes. She's treating specific health problems outside the hospital. That's community-based nursing. Community-based nursing focuses on direct patient care for acute and chronic conditions delivered outside hospital walls. Home health visits, outpatient clinics, community health centres. All community-based. The target is the individual patient or family, and the work is hands-on clinical care. Option A, population-focused nursing, targets entire populations through broad assessment and addresses determinants of health at a population level. This nurse is doing individual clinical care. Option B, community-oriented nursing, shifts focus from individuals to the broader community, aiming to preserve and protect overall community health. This nurse is focused on specific patients. Option D, public health nursing, is a population-focused discipline that works on disease prevention for entire populations, not individual wound care. Here's a WGU D450 OA exam tip for you. If the nurse is providing direct clinical care to individual patients outside a hospital, that's community-based nursing. Quick recall hook. Individual care outside hospital equals community-based. 17. A nurse organises a drive-through influenza vaccination event that is open to every resident in the county, regardless of their individual health status or risk factors. The goal is to protect the entire neighbourhood from seasonal illness. Which practice area best describes this population-level approach? A. Community-based nursing. B. Acute care nursing. C. Individual-focused practice. D. Community-oriented nursing. What do you think is the answer? Correct answer, D. Community-oriented nursing. Explanation: option D is correct because community-oriented nursing focuses on preserving, protecting, and maintaining the health of the broader community through population-accessible interventions, like a neighbourhood-wide vaccination event open to everyone. Option A is incorrect because community-based nursing centres on direct care for individual patients and families with specific acute or chronic conditions, not on organising broad community-wide health protection events for everyone. Option B is incorrect because acute care nursing takes place in hospital settings and focuses on treating patients with immediate serious health needs, which is fundamentally different from a preventive community vaccination event. Option C is incorrect because individual-focused practice aims to change knowledge, attitudes, and behaviours of specific individuals and families, not to deliver a broad intervention accessible to every resident in a community. Here's the next practice area in action. A nurse organises a drive-through flu vaccination event open to every resident in the county, regardless of health status or risk factors. The goal is protecting the entire neighbourhood from seasonal illness. This is community-oriented nursing. Community-oriented nursing shifts the lens from individual patients to the broader community. The goal is to preserve, protect, and maintain the health of the whole community. A drive-through vaccination event that's open to everyone is a population-accessible intervention, exactly what community-oriented practice looks like. Option A, community-based nursing, centres on direct care for individual patients with specific conditions. This event serves the whole community, not individual patients. Option B, acute care nursing, takes place in hospitals and treats immediate serious health needs. Completely different setting and purpose. Option C, individual-focused practice, aims to change knowledge and behaviours of specific individuals and families, not to deliver a broad community-wide intervention. Here's a WGU D450 OA exam tip for you. When the intervention is open to the entire community and the goal is protecting everyone, that's community-oriented nursing. Quick recall hook: open to everyone equals community-oriented. 18. The Head Start programme was created after researchers identified that low-income children across the country lacked access to early childhood education, and the programme was designed to serve that entire affected group nationwide. Which nursing practice area aligns with this approach? A. Community-based nursing. B. Population-focused nursing. C. Community-oriented nursing. D. Systems-focused practice. What do you think is the answer? Correct answer, B. Population-focused nursing. Explanation: option B is correct because the problem was identified through population-level health status assessment across the entire country, and the intervention was designed to reach the whole affected population of low-income children. Option A is incorrect because community-based nursing provides direct care to individuals and families for specific health problems, not broad national interventions designed at the population level to address systemic educational gaps. Option C is incorrect because while community-oriented nursing works with communities and populations, population-focused nursing specifically identifies problems through population-level assessment and designs interventions for entire affected populations nationwide. Option D is incorrect because systems-focused practice involves changing organisations, policies, and power structures within a community, not the broader population-level identification of health gaps and creation of nationwide intervention programmes. Now let's zoom out even further to population-focused nursing. The Head Start programme was created after researchers found that low-income children across the entire country lacked access to early childhood education. The problem was identified at the national population level. The intervention was designed to serve the whole affected population, not just one neighbourhood or community. That's population-focused nursing. Population-focused nursing identifies problems through population-level health status assessment and creates interventions for the entire affected population. It works across all levels of prevention and considers broad determinants of health. Option A, community-based nursing, provides direct care to individual patients for specific problems. Head Start is a national population-level intervention, not individual clinical care. Option C, community-oriented nursing, works with communities and populations, but population-focused nursing specifically identifies problems through population-level assessment and designs interventions that reach the entire affected population nationwide. The scale is the differentiator. Option D, systems-focused practice, involves changing organisations, policies, and power structures within a community. That's a level of practice focus, not a nursing practice area. Here's a WGU D450 OA exam tip for you. When the problem is identified at the population level and the intervention targets the entire affected group, that's population-focused nursing. Quick recall hook: nationwide problem plus nationwide solution equals population-focused. 19. A nurse is trying to distinguish between two colleagues. One provides home visits to manage a diabetic patient's insulin regimen. The other coordinates a county-wide diabetes awareness campaign targeting all residents. Which statement best differentiates their practice areas? A. The first is community-based and the second is community-oriented. B. Both are community-oriented nurses. C. The first is population-focused and the second is community-based. D. Both are community-based nurses. Do you know the answer? Correct answer: A. The first is community-based and the second is community-oriented. Explanation: Option A is correct because managing an individual patient's insulin at home is community-based nursing, while coordinating a county-wide awareness campaign for all residents reflects community-oriented nursing's population-level health focus. Option B is incorrect because the nurse providing home visits for individual insulin management is delivering direct patient care for a specific condition, which is community-based nursing rather than community-oriented practice. Option C is incorrect because it reverses the correct classification, since the home visit nurse focuses on individual care, which is community-based, and the campaign nurse focuses on population health, which is community-oriented. Option D is incorrect because while both nurses work outside hospital settings, the county-wide campaign nurse is working at the community level to protect population health, which goes beyond community-based individual patient care. This question tests whether you can distinguish between practice areas when both appear side by side. One nurse makes home visits to manage a diabetic patient's insulin regimen. The other coordinates a county-wide diabetes awareness campaign targeting all residents. The first nurse is doing community-based nursing, direct clinical care to an individual patient for a specific condition, delivered outside the hospital. The second nurse is doing community-oriented nursing, working at the community level to protect and promote health for an entire population. Option B says both are community-oriented. That's wrong because the home visit nurse is focused on one patient's insulin, not on community-wide health. Option C reverses the classification entirely. It calls the home visit nurse population focused and the campaign nurse community based. That's backwards. Option D says both are community based. The county-wide campaign nurse is clearly working at the population level, not treating individual patients. Here's a WGU D450 OA exam tip for you. When comparing two nurses in a question, ask, is this nurse treating an individual or serving a population? Individual clinical care equals community-based. Population-level health protection equals community-oriented. Quick recall hook. One patient equals community-based. Whole county equals community-oriented. 20. A nurse notices that parents of school-aged children across multiple districts share a common concern about childhood obesity, but do not live in the same neighbourhood or interact with each other directly. Which population concept best describes this group of parents? A. Community. B. Aggregate. C. Population. D. Formal group. What do you think is the answer? Correct answer, C. Population. Explanation. Option C is correct because a population is a collection of individuals sharing common characteristics who do not need to share a geographic boundary or interact with each other, which exactly describes these parents. Option A is incorrect because a community requires that members share characteristics, interact with each other, and often share a geographical location, but these parents across multiple districts do not interact directly. Option B is incorrect because an aggregate is a smaller selected segment of a population that is small enough to be interacted with directly, while this group spans multiple districts and is too dispersed for direct interaction. Option D is incorrect because a formal group is a longer-term group with bigger goals that shares a common purpose and meets together, which does not describe scattered parents across districts who have not organised collectively. Let's wrap this set with population concepts, which the exam tests constantly. A nurse notices parents of school-aged children across multiple districts share a common concern about childhood obesity. They don't live in the same neighbourhood. They don't interact with each other directly. The question asks what population concept describes this group. The answer is population. A population is a collection of individuals who share one or more common characteristics, but do not need to share a geographic boundary or interact with each other. These parents across multiple districts fit that definition exactly. Option A says community. A community requires shared characteristics, interaction, and often a shared geographic location. These parents don't interact and are spread across districts. Option B says aggregate. An aggregate is a selected segment of a population, small enough to be interacted with directly. This group spans multiple districts and is too dispersed for that. Option D says formal group. A formal group is a longer-term organised group with bigger goals that meets together. These parents haven't organised at all. Here's a WGU D450 OA exam tip for you. If the group shares characteristics but doesn't interact or share geography, it's a population. If they share characteristics and do interact in a shared location, it's a community. Quick recall hook. Shared traits but no interaction equals population. 21. A pregnant teenager feels scared and overwhelmed about her situation until she meets with a young mother from a peer support program who shares her own positive experience with prenatal care and parenting. The teenager becomes motivated to seek prenatal visits. Which learning domain drove this behaviour change? A. Cognitive domain. B. Psychomotor domain. C. Behavioural domain. D. Affective domain. What do you think is the answer? Correct answer, D. Affective domain. Explanation. Option D is correct because the teenager's emotional response of feeling motivated after connecting with the peer mother drove the behaviour change, and the affective domain involves moods and emotions that influence learning. Option A is incorrect because the cognitive domain involves brain-based knowledge acquisition, such as memorizing and applying information. But the teenager's change was driven by emotional connection rather than intellectual understanding. Option B is incorrect because the psychomotor domain involves learning through physical activity, hands-on practice, and skill development, which does not describe the emotional motivation experienced by the teenager in this scenario. Option C is incorrect because while the behavioral learning theory involves reinforcement driving behavior, the scenario specifically describes an emotional connection motivating change rather than a reward or consequence-based reinforcement system. To really understand why the affective domain is the correct choice here, you need to know how the three learning domains work. This question describes a pregnant teenager who feels scared and overwhelmed. She meets a young mother from a peer support program who shares a positive experience with prenatal care. The teenager's emotions shift. She goes from fear to motivation. That emotional change drives her to seek prenatal visits. That's the affective domain. The affective domain's all about moods and emotions influencing learning. When someone's emotional state changes, and that change causes a behavior shift, the affective domain is in play. Option A, the cognitive domain, is about brain-based knowledge. Memorizing facts, recognizing information, applying what you've learned in a classroom. The teenager didn't change because she memorized something. She changed because she felt something. Option B, the psychomotor domain, involves learning through physical activity. Hands-on practice, demonstrations, physical skill building. Nothing physical happened here. Option C says behavioral domain, but behavioral theory is about reinforcement and consequences driving behavior. There was no reward or punishment system at work. The teenager connected emotionally with a peer, and that emotional connection drove the change. Here's a WGU D450 OA exam tip for you. When a scenario describes feelings like fear, hope, motivation, or emotional connection causing someone to change their behavior, the answer is the affective domain. Quick recall hook. Emotion drives action equals affective. 22. A community health nurse notices that a client with high blood pressure understands the risks of untreated hypertension, believes medication will help, and feels confident that taking daily medication will improve quality of life. Which health behavior model best explains this client's motivation? A. Health belief model. B. Social learning theory. C. Trans-theoretical model. D. Developmental theory. Can you guess the answer? Correct answer, A. Health belief model. Explanation. Option A is correct because the health belief model focuses on internal beliefs as motivators, and this client demonstrates belief in susceptibility, severity, benefits of treatment, and improved life outcomes driving behavior. Option B is incorrect because social learning theory centers on self-efficacy and learning through expectations and modeling others, rather than on the specific belief components of susceptibility, severity, benefits, and barriers described here. Option C is incorrect because the trans-theoretical model describes behavior change as movement through sequential stages over time, not the internal belief assessment of susceptibility, severity, and benefits driving motivation. Option D is incorrect because developmental theory focuses on matching teaching approaches to a learner's developmental level and assessing readiness, not on internal health beliefs about susceptibility, severity, and personal benefit. This question is testing one of the most important health behavior models on the exam, the health belief model. The client has high blood pressure. He understands the risks of untreated hypertension, believes medication will help, and feels confident that taking daily medication will improve his quality of life. Three internal beliefs are at work here: perceived susceptibility, perceived severity, and perceived benefit. The health belief model says people are motivated to change when they value the end product, believe there's a benefit to the change, and feel their life situation will improve. This client checks all those boxes. Option B, social learning theory, centers on self-efficacy and learning by watching others succeed. There's no mention of modelling or peer observation here. It's all internal belief. Option C, the trans-theoretical model, describes behaviour change as movement through sequential stages over time. The question isn't about stages, it's about the beliefs driving motivation. Option D, developmental theory, focuses on matching teaching methods to the learner's developmental level. That's not what's being described. Here's a WGU D450 OA exam tip for you. When you see the words believes, perceives risk, sees benefit, or feels susceptible in a question, the answer is the health belief model. Quick recall hook: believes it will help equals health belief model. 23. A nurse educator has been running a 4-week smoking cessation class and wants to check halfway through whether participants are progressing toward the program goals so adjustments can be made before the final session. Which type of evaluation should the nurse perform at this midpoint? A, summative evaluation. B, process evaluation. C, formative evaluation. D, outcome evaluation. Can you guess the answer? Correct answer, C, formative evaluation. Explanation: option C is correct because formative evaluation occurs partway through the learning period to identify what changes are needed and helps participants and educators understand current progress before the program concludes. Option A is incorrect because summative evaluation occurs at the end of the learning process to wrap up all learning and summarise what occurred throughout the entire educational experience, not at the midpoint. Option B is incorrect because process evaluation is ongoing continuous monitoring throughout the entire program to determine if objectives are being met, rather than a specific midpoint checkpoint for making targeted adjustments. Option D is incorrect because outcome evaluation measures the concrete health impact of an intervention after completion, such as changes in health indicators, not midpoint progress checks during an ongoing educational program. Evaluation types trip up a lot of students, so let's get these categories straight. The nurse is running a 4-week smoking cessation class and wants to check halfway through whether participants are progressing. She wants to make adjustments before the final session. That midpoint check is formative evaluation. Formative evaluation happens partway through the learning period. Think of it like a midterm exam. It identifies what changes are needed and helps both the learner and educator understand where things stand while there's still time to adjust. Option A, summative evaluation, happens at the end. It wraps up all learning and summarises what occurred throughout the entire experience. That's the final exam, not the midterm. Option B, process evaluation, is ongoing continuous monitoring throughout the entire program. It's not a specific midpoint checkpoint. It's the constant checking that happens every day. Option D, outcome evaluation, measures the concrete health impact after the program is complete, like changes in smoking rates. That's a post-program measurement, not a midpoint assessment. Here's a WGU D450 OA exam tip for you. Formative is in the middle, summative is at the end. If the question says midpoint, halfway, or midway, the answer is formative. Quick recall hook: midpoint check equals formative. 24. A nurse designs a diabetes education program and wants to measure whether the program actually improved participants' health after completion. She plans to compare fasting blood glucose averages from before the program to readings taken after the final class session. Which evaluation type is she planning? A, formative assessment. B, outcome evaluation. C, process evaluation. D, qualitative evaluation. What do you think is the answer? Correct answer, B, outcome evaluation. Explanation: option B is correct because comparing measurable health indicators before and after program completion determines the concrete health impact of the intervention, which defines outcome evaluation or summative assessment of effectiveness. Option A is incorrect because formative assessment occurs during the learning period to identify needed adjustments and track progress, not after program completion to measure final health outcomes against baseline measurements. Option C is incorrect because process evaluation is ongoing monitoring during the program to check whether objectives and goals are being met in real time, not a final comparison of pre- and post-program health data. Option D is incorrect because qualitative evaluation gathers descriptive non-numerical information about experiences and perceptions, while comparing blood glucose averages is a quantitative measurement of concrete health outcomes. Now let's look at what happens when the program is over and the nurse wants to know if it actually worked. This nurse designed a diabetes education program and plans to compare fasting blood glucose averages from before the program to readings taken after the final class. She's measuring concrete health improvement after completion. That's outcome evaluation. Outcome evaluation asks one question: did the intervention produce a measurable health result? You compare a baseline measurement to a post-intervention measurement and see if the numbers moved. Option A, formative assessment, happens during the learning period to check progress and make adjustments. This nurse is measuring after everything is done. Option C, process evaluation, is ongoing monitoring during the program to see if objectives are being met in real time. It's not a final before and after comparison. Option D, qualitative evaluation, gathers descriptive non-numerical information. Perceptions, experiences, opinions. Comparing blood glucose averages is quantitative, not qualitative. Here's a WGU D450 OA exam tip for you. When the question asks about measuring health outcomes before and after a program, that's outcome evaluation. The word compare with measurable data is the giveaway. Quick recall hook. Before versus after health data equals outcome evaluation. 25. A nurse is planning a health education session for a group of elderly adults who have limited reading ability and come from diverse cultural backgrounds. The nurse must adapt the teaching approach to ensure the material is understood. Which factor should the nurse address first to ensure effective learning? A. Psychomotor skill readiness. B. Generational learning preferences. C. Effective emotional barriers. D. Health literacy of the audience. Can you guess the answer? Correct answer, D. Health literacy of the audience. Explanation. Option D is correct because health literacy is a major factor in education effectiveness. And if learners cannot understand the concepts being taught, the education will fail regardless of how well it is delivered. Option A is incorrect because psychomotor skill readiness relates to physical hands-on learning and practice, which is not the primary barrier described in this scenario involving limited reading ability and cultural diversity. Option B is incorrect because while generational experiences do affect learning, the nurse must first ensure the audience can actually understand the educational content by addressing their health literacy level before anything else. Option C is incorrect because affective emotional barriers can influence learning motivation and engagement, but the scenario specifically highlights limited reading ability and cultural diversity as the primary challenges needing attention first. This question targets a concept that's easy to overlook: health literacy. The nurse is planning education for elderly adults with limited reading ability who come from diverse cultural backgrounds. The question asks what the nurse should address first. The answer is health literacy. Here's why. If learners can't understand the material being presented, nothing else matters. You can have the best teaching method, the most emotionally supportive environment, and perfectly age-appropriate content. But if the audience can't read or comprehend what you're delivering, the education fails. Health literacy is the gatekeeper. Option A, psychomotor skill readiness, relates to physical hands-on learning. The scenario isn't about physical skills, it's about comprehension barriers. Option B, generational learning preferences, matters, but you address comprehension first. If the audience can't understand you, tailoring to their generation won't help. Option C, effective emotional barriers can influence motivation. But again, Kitty, understanding the material comes before managing emotions about it. Here's a WGU D450 OA exam tip for you. When a question mentions limited reading ability, low education level, or diverse cultural backgrounds in the context of teaching, health literacy is almost always the first priority. Quick recall hook, can't read it, can't learn it, equals health literacy first. 26. A nursing student is researching the origins of population-based health approaches and discovers a historical figure who improved soldier health during wartime by focusing on sanitation, nutrition, and environmental conditions rather than treating individual illnesses. Which historical figure pioneered this population-based, environmental approach to health? A. Florence Nightingale. B. Lillian Wald. C. Mary Breckinridge. D. William Rathbone. Can you guess the answer? Correct answer, A. Florence Nightingale. Explanation: option A is correct because Nightingale improved soldier health during the Crimean War by focusing on environmental factors like sanitation, nutrition, and hygiene, establishing the foundation for population-based health approaches. Option B is incorrect because Lillian Wald is recognized as the first public health nurse in the United States who established the Henry Street Settlement and visiting nurse services in New York City communities. Option C is incorrect because Mary Breckinridge established the Frontier Nursing Service to bring nurse midwifery and public health services to underserved rural populations, not wartime population-based environmental health improvements. Option D is incorrect because William Rathbone founded the first District Nursing Association in Liverpool and helped establish the early model for home health nursing, not a wartime environmental health approach. Historical figures are a guaranteed section on this exam, so let's lock them in. The question describes someone who improved soldier health during wartime by focusing on sanitation, nutrition, and environmental conditions instead of treating individual illnesses. That's Florence Nightingale. Nightingale's work during the Crimean War established the groundwork for population-based health. Her core principle was that the health of the unit is the health of the community. She differentiated between sick nursing, which treats illness, and health nursing, which promotes wellness. She pushed for proper nutrition, rest, sanitation, and hygiene. Environmental factors, not individual treatment. Option B, Lillian Wald, was the first public health nurse in the United States. She established the Henry Street Settlement and visiting nurse services in New York City. Different person, different contribution. Option C, Mary Breckinridge, established the Frontier Nursing Service and brought nurse midwifery to underserved rural populations. Rural healthcare, not wartime environmental health. Option D, William Rathbone, founded the first District Nursing Association in Liverpool and helped create the early model for home health nursing. Not wartime work. Here's a WGU D450 OA exam tip for you. Crimean War, sanitation, environmental health, sick nursing versus health nursing. Those keywords all point to Nightingale. Quick recall hook. Crimean War plus environment equals Nightingale. 27. A public health professor asks students to identify the historical figure whose investigation of disease patterns in a specific neighbourhood led to the removal of a contaminated water source, effectively demonstrating that systematic data collection could trace illness to environmental causes. Which figure is being described? A. Florence Nightingale. B. Lemuel Shattuck. C. William Rathbone. D. John Snow. What do you think is the answer? Correct answer, D. John Snow. Explanation: Option D is correct because John Snow is recognised as the first epidemiologist who linked cholera rates to contaminated water pumps in London through systematic data collection and analysis of disease patterns. Option A is incorrect because Florence Nightingale focused on improving health through environmental conditions like sanitation and nutrition during the Crimean War, not on investigating specific disease transmission through contaminated water sources. Option B is incorrect because Lemuel Shattuck authored a report documenting unsanitary conditions and high mortality in Massachusetts and made public health reform recommendations, but did not investigate specific disease transmission patterns. Option C is incorrect because William Rathbone established the first district nursing association in Liverpool to provide home nursing care and was not involved in epidemiological investigation of disease transmission through water sources. Here's another historical figure you absolutely need to know. The question describes someone who investigated disease patterns in a specific neighbourhood and traced illness to a contaminated water source, proving that systematic data collection could identify environmental causes of disease. That's John Snow. Snow is recognised as the first epidemiologist. In 1854, he linked cholera rates in London to contaminated water pumps, specifically the Broad Street pump. He didn't treat individual patients, he collected data, mapped cases, and traced the disease to its source. That's the foundation of epidemiology. Option A, Florence Nightingale, improved health through environmental conditions during the Crimean War. She didn't investigate specific waterborne disease transmission in a neighbourhood. Option B, Lemuel Shattuck, authored a report documenting unsanitary conditions and high mortality in Massachusetts. He made reform recommendations, but he didn't conduct a field investigation tracing disease to a specific source. Option C, William Rathbone, established district nursing in Liverpool. Home nursing, not epidemiological investigation. Here's a WGU D450 OA exam tip for you. Cholera, water pumps, London 1854, first epidemiologist. All of those point to John Snow. Quick recall hook, cholera plus water pump equals Snow. 28. A nurse educator explains that one historical figure challenged the idea that professional nursing should only serve wealthy, private clients by establishing a settlement house and visiting nurse services to care for impoverished communities in their own homes. Which figure broke this barrier in American public health nursing? A. Mary Breckinridge. B. Lillian Wald. C. Florence Nightingale. D. John Snow. Can you guess the answer? Correct answer, B. Lillian Wald. Explanation. Option B is correct because Lillian Wald established the Henry Street Settlement and visiting nurse services in New York City, providing care to poor communities in their homes rather than reserving nursing for wealthy clients. Option A is incorrect because Mary Breckinridge focused on bringing nurse midwifery and healthcare services to underserved rural populations through the Frontier Nursing Service, not on urban settlement house and visiting nurse work. Option C is incorrect because Florence Nightingale's primary contribution was establishing population-based environmental health approaches during the Crimean War in England, not creating urban settlement house nursing services in America. Option D is incorrect because John Snow was an epidemiologist who investigated cholera transmission through contaminated water in London and did not establish nursing services for impoverished urban communities in America. This question tests another historical figure, one who changed who nursing served. The scenario describes someone who challenged the idea that professional nursing should only serve wealthy private clients. She established a settlement house and visiting nurse services to care for impoverished communities in their own homes. That's Lillian Wald. Wald is recognised as the first public health nurse in the United States. She and Mary Brewster established the Henry Street Settlement in New York City. Their innovation was bringing professional nursing to poor communities rather than keeping it reserved for people who could afford private care. Option A, Mary Breckinridge, focused on rural populations through the Frontier Nursing Service. She brought nurse midwifery to remote areas, not urban settlement housework. Option C, Florence Nightingale contributed to population-based environmental health during the Crimean War in England, not American settlement house nursing. Option D, John Snow was an epidemiologist who investigated cholera in London. He didn't establish nursing services for anyone. Here's a WGU D450 OA exam tip for you. Henry Street Settlement, visiting nurses, first US public health nurse, care for the poor, all Lillian Wald. Quick recall hook. Henry Street plus poor communities equals Wald. 29. A rural health clinic celebrates its anniversary by honouring the historical figure who proved that professional healthcare could reach remote communities by establishing a service that brought nurse midwifery to underserved areas far from urban medical centres. Which historical figure does this celebration honour? A. Lillian Walt. B. William Rathbone. C. Mary Breckinridge. D. Florence Nightingale. What do you think is the answer? Correct answer, C. Mary Breckinridge. Explanation. Option C is correct because Mary Breckinridge established the Frontier Nursing Service, which developed public health services and brought nurse midwifery to underserved rural populations far from urban healthcare centres. Option A is incorrect because Lillian Wald focused on providing nursing care to impoverished urban communities in New York City through the Henry Street Settlement, not on reaching remote rural populations with midwifery. Option B is incorrect because William Rathbone founded the first District Nursing Association in Liverpool to establish home nursing care in an urban English setting, not rural American nurse midwifery services. Option D is incorrect because Florence Nightingale established environmental health and population-based nursing approaches during the Crimean War, and her work was not specifically focused on delivering nurse midwifery to rural American communities. Let's complete the set of historical figures with Mary Breckinridge. The question describes a rural health clinic, honouring someone who proved professional healthcare could reach remote communities by establishing a service that brought nurse midwifery to underserved areas far from urban medical centres. That's Breckinridge. She established the Frontier Nursing Service. Her contribution was showing that professional healthcare, specifically nurse midwifery, could actually be delivered to people living in remote, rural areas where no one else would go. Option A, Lillian Wald, focused on impoverished urban communities in New York City. She's the Henry Street Settlement and visiting nurses. Urban, not rural. Option B, William Rathbone, founded district nursing in Liverpool, England. That's an urban English model for home nursing, not rural American midwifery. Option D, Florence Nightingale, worked on wartime environmental health during the Crimean War, not rural American healthcare delivery. Here's a WGU D450 OA exam tip for you. Frontier Nursing Service, rural populations, nurse midwifery in remote areas. Those keywords all point to Mary Breckinridge. Quick recall hook, frontier plus rural midwifery equals Breckinridge. 30. A public health class discusses a landmark report from Massachusetts that documented unsanitary conditions, high infant mortality, and high overall death rates, and made 50 recommendations for reform, including vital records and disease monitoring. Which historical document is being discussed? A. The Shattuck Report. B. The Nightingale Report. C. The Henry Street Charter. D. The Frontier Nursing Plan. Do you know the answer? Correct answer, A. The Shattuck Report. Explanation. Option A is correct because Lemuel Shattuck's report documented unsanitary conditions and high mortality in Massachusetts, making 50 recommendations for public health reform, of which 36 remain accepted principles today. Option B is incorrect because there is no single landmark document known as the Nightingale Report in public health history, and Nightingale's contributions centred on wartime environmental health improvements rather than state-level reform documentation. Option C is incorrect because the Henry Street Charter is not a recognised historical public health document, and the Henry Street Settlement was established by Lillian Wald to provide visiting nurse services to urban poor communities. Option D is incorrect because the Frontier Nursing Plan is not a recognised historical public health document, and the Frontier Nursing Service was Mary Breckinridge's organisation for delivering rural nurse midwifery healthcare services. One more historical document you need to know, the Shattuck Report. The question describes a landmark report from Massachusetts that documented unsanitary conditions, high infant mortality, high overall death rates, and made 50 recommendations for reform, including vital records and disease monitoring. That's the Shattuck Report. Lemuel Shattuck wrote this report addressing public health issues in Massachusetts. Of his 50 recommendations, 36 remain accepted principles of public health today. His recommendations included vital records bookkeeping, disease notification, and monitoring, well-child programs, and immunisations. Option B, the Nightingale Report, doesn't exist as a recognised landmark public health document. Nightingale's contributions were practical, not a single reform document. Option C, the Henry Street Charter, is made up. Henry Street is associated with Lillian Wald's settlement house, not a reform report. Option D, the Frontier Nursing Plan, also doesn't exist as a historical document. The Frontier Nursing Service was Breckinridge's organisation. Here's a WGU D450 OA exam tip for you. Massachusetts, unsanitary conditions, 50 recommendations, vital records. Those keywords point to the Shattuck Report. Quick recall hook. Massachusetts plus 50 recommendations equals Shattuck. 31. A public health nurse conducts targeted outreach in a neighbourhood with low prenatal care utilisation, going door to door to identify pregnant women who have not yet connected with healthcare services and linking them to available prenatal clinics. Which nursing role best describes this activity? A. Referral agent. B. Advocate. C. Health planner. D. Case finder. What do you think is the answer? Correct answer, D. Case finder. Explanation. Option D is correct because a case finder conducts targeted outreach to locate individuals who need help and connects them with appropriate care, which exactly describes the nurse's door-to-door identification and linkage efforts. Option A is incorrect because a referral agent maintains current information about community services and connects clients who've already been identified to those resources, rather than actively searching for unidentified clients. Option B is incorrect because an advocate facilitates efforts to obtain needed healthcare, including legislative advocacy for population health, not the targeted outreach activity of locating unidentified individuals who need services. Option C is incorrect because a health planner develops and implements health services for at-risk populations, such as organising immunisation clinics, rather than conducting individual-level targeted outreach to locate specific clients needing care. Now we're into nursing roles, which the exam tests by describing an activity and asking you to name the role. This nurse goes door to door in a neighbourhood with low prenatal care use, actively looking for pregnant women who haven't connected with healthcare services, and then links them to available prenatal clinics. That's the case finder role. A case finder conducts targeted outreach to locate individuals who need help and connects them with appropriate care. The key distinction is that the case finder goes out looking for people who haven't been identified yet. Option A, referral agent, maintains an updated directory of resources and connects clients who have already been identified. The referral agent waits for clients to come. The case finder goes to them. Option B, advocate, facilitates efforts to obtain resources, including legislative advocacy. Testifying before a city council is advocacy. Door-to-door outreach is case finding. Option C, health planner, develops and implements health services for at-risk populations, like organising an immunisation clinic. That's designing the service, not going out to find the people who need it. Here's a WGU D450 OA exam tip for you. If the nurse is actively going out to find people who need care, that's case finding. If the nurse is connecting already identified people to resources, that's a referral agent. Quick recall hook. Going out to find them equals case finder. 32. A nurse working in a community health centre helps a client with multiple chronic conditions coordinate appointments across 3 different specialists, arrange transportation to each visit, and navigate insurance coverage for all prescribed medications. Which nursing role best matches this coordination activity? A. Counsellor, B. Case manager, C. Educator, D. Caregiver. What do you think is the answer? Correct answer, B. Case manager. Explanation: option B is correct because a case manager helps clients make decisions about managing health services and integrates and coordinates care across multiple providers, which describes this nurse's coordination of specialists and resources. Option A is incorrect because a counsellor helps clients cope with stressors, prevent crises, and adapt to health changes through interpersonal relationship, not through the logistical coordination of appointments, transportation, and insurance coverage. Option C is incorrect because an educator promotes health action and facilitates behaviour change through teaching, which is a different function from coordinating care across multiple healthcare providers and managing service logistics. Option D is incorrect because a caregiver provides direct care to patients focused on populations rather than just individuals, while this scenario specifically describes coordination and management of services rather than hands-on clinical care. Here's a role that comes up constantly: case manager. The nurse in this question is helping a client with multiple chronic conditions coordinate appointments across 3 different specialists, arrange transportation to each visit, and navigate insurance coverage for all prescribed medications. That's coordination of care across multiple providers and services. That's the case manager role. A case manager helps clients make decisions about managing health services, integrating and coordinating care across providers. The key word is coordination, pulling together multiple moving parts into one coherent plan for the client. Option A, counsellor, helps clients cope with stressors and solve problems through interpersonal relationship. That's emotional support, not logistics coordination. Option C, educator, promotes health action through teaching. Nobody's being taught here. Services are being coordinated. Option D, caregiver, provides direct hands-on care. The nurse isn't doing wound care or administering medication. She's coordinating appointments and insurance. Here's a WGU D450 OA exam tip for you. When you see a nurse coordinating multiple providers, arranging services, managing appointments, and navigating insurance, the answer is case manager. Quick recall hook. Coordinating multiple services equals case manager. 33. A public health nurse analyses patterns of lead poisoning cases across several neighbourhoods, determines that older housing with deteriorating paint is the common factor, and designs a community intervention targeting those specific areas. Which nursing role does this analytical work best represent? A. Epidemiologist, B. Advocate, C. Group leader, D. Manager. What do you think is the answer? Correct answer, A. Epidemiologist. Explanation: option A is correct because an epidemiologist analyses health problems in populations, determines causes of those problems, and designs interventions based on the analysis, which directly describes this nurse's pattern, analysis and response. Option B is incorrect because an advocate speaks or acts on behalf of individuals or communities to obtain needed resources and legislative support, not the analytical investigation of disease patterns and determination of environmental causes. Option C is incorrect because a group leader uses group process to deliver targeted preventive services and manage caseload responsibilities, rather than conducting population-level analysis of disease patterns and their environmental determinants. Option D is incorrect because a manager handles caseload demands involving multiple individuals, which is an administrative function rather than the analytical investigation of population-level disease patterns and their root causes. This question tests a role that students sometimes confuse with others, the epidemiologist. The nurse analyses patterns of lead poisoning across several neighbourhoods, determines that older housing with deteriorating paint is the common factor, and designs a community intervention targeting those specific areas. That sequence, analysing patterns, determining causes, designing interventions, is the epidemiologist role. An epidemiologist analyses health problems in populations, determines what's causing them, and designs interventions based on the findings. Option B, advocate, speaks or acts on behalf of individuals or communities to obtain needed resources. The nurse here is analysing data, not speaking before a legislature. Option C, group leader, uses group process to deliver preventive services and manage caseloads. That's a different function entirely. Option D, manager, handles caseload demands involving multiple individuals. That's administrative, not analytical. Here's a WGU D450 OA exam tip for you, analysing disease patterns, identifying causes and designing interventions based on the data. That's the epidemiologist role. Quick recall hook, analyse patterns plus find cause equals epidemiologist. 34. A nurse at a health department testifies before the City Council, urging them to fund a new maternal health programme after data revealed that low-income pregnant women in the community lack access to adequate prenatal care and nutrition services. Which nursing role is the nurse performing? A. Health planner. B. Case manager. C. Advocate. D. Epidemiologist. Can you guess the answer? Correct answer, C. Advocate. Explanation: option C is correct because an advocate facilitates efforts to obtain needed healthcare, including legislative advocacy for population health. And testifying before a city council to secure funding is a clear example of legislative advocacy. Option A is incorrect because a health planner develops and implements health services for at-risk populations, such as organising clinics. But the nurse in this scenario is specifically advocating before government rather than designing service delivery. Option B is incorrect because a case manager coordinates care and services for individual clients with complex needs, not testifying before legislative bodies to secure funding for population-level health programs and resources. Option D is incorrect because an epidemiologist analyses health problems in populations and determines causes. But this nurse has moved beyond analysis and is actively advocating before the City Council for funding and resource allocation. This role is all about speaking up for the population. A nurse testifies before the City Council, urging them to fund a new maternal health programme after data revealed that low-income pregnant women lack access to prenatal care and nutrition services. The nurse isn't collecting data. She isn't coordinating individual care. She's standing in front of a legislative body and pushing for resources. That's the advocate role. An advocate facilitates efforts to obtain needed healthcare, including legislative advocacy for population health. Option A, health planner, develops and implements health services. The nurse here hasn't designed a programme. She's pushing the government to fund one. Planning is different from advocating. Option B, case manager, coordinates care for individual clients with complex needs. This nurse is speaking to the City Council about a population, not managing one person's appointments. Option D, epidemiologist, analyses health problems and determines causes. The analysis is done. The nurse has moved to the advocacy phase. Here's a WGU D450 OA exam tip for you. When the nurse is testifying, lobbying or speaking before a legislative body to get funding or policy changes, The answer is advocate. Quick recall hook. Testifying for resources equals advocate. 35. A community nurse maintains an updated directory of local food banks, mental health clinics, housing assistance programs, and transportation services so she can quickly connect families in need with the most appropriate community resource for their situation. Which nursing role does this describe? A. Case manager. B. Case finder. C. Counsellor. D. Referral agent. Do you know the answer? Correct answer, D. Referral agent. Explanation: option D is correct because a referral agent maintains current information about community services and connects clients to those resources, which directly matches the nurse's activity of keeping an updated directory for client referrals. Option A is incorrect because a case manager coordinates care across multiple providers for clients with complex needs, which involves more comprehensive service integration than simply maintaining a resource directory and making referrals. Option B is incorrect because a case finder conducts targeted outreach to locate individuals who need care and connects them to services, focusing on finding unidentified clients rather than maintaining a resource directory for incoming requests. Option C is incorrect because a counsellor establishes an interpersonal relationship to help clients cope with stressors and solve problems, which is a therapeutic support role rather than a resource connection and directory maintenance function. Here's a role that gets confused with case manager, so pay attention to the difference. The nurse maintains an updated directory of local food banks, mental health clinics, housing assistance programs, and transportation services so she can quickly connect families in need with the right resource. That's the referral agent role. A referral agent maintains current information about community services and connects clients to those resources. The key activity is maintaining the directory and making the connection. Compare that to the case manager, who coordinates complex care across multiple providers. The referral agent is a connector. The case manager is a coordinator. Option A, case manager, involves coordinating appointments, insurance, and multiple specialists. This nurse is simply connecting families to the right service, not managing an entire care plan. Option B, case finder, goes out looking for unidentified people who need services. This nurse isn't searching for clients. She's connecting ones who have already been identified. Option C, counsellor, provides emotional support through interpersonal relationship. Maintaining a resource directory is not counselling. Here's a WGU D450 OA exam tip for you. Directory of resources plus connecting clients to those resources equals referral agent. Coordinating complex care across multiple providers equals case manager. Quick recall hook. Resource directory equals referral agent. 36. A public health team is investigating a cluster of respiratory illness at a daycare centre and determines that the children are the ones getting sick. The virus is the causative organism, and the poorly ventilated building is contributing to transmission. Which epidemiological framework organises these three interacting components? A. Levels of prevention model. B. The epidemiological triad. C. The core functions framework. D. The public health intervention wheel. Do you know the answer? Correct answer, B. The epidemiological triad. Explanation: option B is correct because the epidemiological triad consists of three interacting components: the agent causing disease, the host affected by it, and the environment influencing transmission between them. Option A is incorrect because the levels of prevention model classifies interventions as primary, secondary, or tertiary based on disease stage, not the three interacting components of agent, host, and environment. Option C is incorrect because the core functions framework identifies assessment, policy development, and assurance as public health responsibilities, not the interacting components of disease causation involving agent, host, and environment. Option D is incorrect because the public health intervention wheel describes 18 specific interventions used in public health practice, not the three fundamental components of disease causation and transmission in epidemiological analysis. Now we're stepping into epidemiology, and this question asks about a foundational framework. A public health team is investigating respiratory illness at a daycare centre. They identify the children as the ones getting sick, the virus as the cause, and the poorly ventilated building as contributing to transmission. Three interacting components: host, agent, environment. That's the epidemiological triad. The triad is the basic framework for understanding disease causation. The agent causes the disease, the host is affected by it, and the environment influences how the agent and host interact. Option A, levels of prevention, classifies interventions as primary, secondary, or tertiary. That's a different framework entirely. Option C, the core functions framework, identifies assessment, policy development, and assurance. Those are administrative functions of public health, not disease causation components. Option D, the public health intervention wheel, describes 18 specific interventions. Also a different model. Here's a WGU D450 OA exam tip for you. When a question identifies three components, what's causing disease, who's getting sick, and what surroundings are involved, that's the epidemiological triad. Quick recall hook: agent plus host plus environment equals triad. 37. A nurse is working to prevent farm machinery injuries and decides to focus intervention efforts on the equipment itself by collaborating with lawmakers to mandate safer tractor design standards. In the epidemiological triad, which component is the nurse targeting with this legislative approach? A, the agent; B, the host; C, the environment; D, the population. Can you guess the answer? Correct answer, A, the agent. Explanation: option A is correct because in the epidemiological triad, the agent is the cause of disease or injury, and farm machinery is the agent causing injuries, so mandating safer tractor design directly targets the agent. Option B is incorrect because the host refers to the individual or population affected by the agent, and targeting the host would involve educating farmers on safe operating practices rather than changing the equipment design itself. Option C is incorrect because the environment refers to the surroundings influencing agent-host interaction, and targeting the environment would involve improving working conditions or terrain rather than changing the machinery design through legislation. Option D is incorrect because the population is not one of the three components of the epidemiological triad, which specifically consists of the agent, the host, and the environment as its interacting elements. This is a practical application of the epidemiological triad, and it tests whether you know which component is being targeted. The nurse wants to prevent farm machinery injuries and decides to focus on the equipment itself by working with lawmakers to mandate safer tractor design. The machinery is the agent. It's the thing causing the injury. Mandating safer design targets the agent directly. If the nurse had focused on educating farmers about safe operating practices, that would target the host. If the nurse had improved working conditions or terrain, that would target the environment. But she went after the equipment itself. That's the agent. Option B, the host, is the farmer, the person affected by the injury. Targeting the host means changing the farmer's behaviour, not the tractor's design. Option C, the environment, refers to the surroundings. Improving roads, lighting or terrain would be environmental. The nurse targeted the machinery. Option D, the population, is not one of the three triad components. The triad is agent, host, environment, nothing else. Here's a WGU D450 OA exam tip for you. Ask yourself, is the intervention changing the thing causing harm, the person at risk, or the surroundings? That tells you which triad component is being targeted. Quick recall hook: Changing the equipment equals targeting the agent. 38. A 2-month-old infant is diagnosed with an infectious disease, and the public health nurse suspects the infant acquired the infection from the mother during pregnancy or shortly after birth. The nurse needs to investigate the route of transmission. Which type of disease transmission should the nurse investigate first? A. Airborne transmission. B. Fomite transmission. C. Vertical transmission. D. Horizontal transmission. Can you guess the answer? Correct answer, C. Vertical transmission. Explanation: option C is correct because vertical transmission refers to disease passed from mother to infant during pregnancy, childbirth or breastfeeding, which matches the suspected route for this 2-month-old infant's infection. Option A is incorrect because airborne transmission involves pathogens carried through the air over distances and is not the specific mother-to-infant transmission route suspected when an infant this young contracts an infectious disease. Option B is incorrect because fomite transmission involves pathogens spread through contaminated objects or surfaces, which is not the mother-to-infant transmission pathway that the nurse should investigate first for a 2-month-old. Option D is incorrect because horizontal transmission refers to person, spread through direct or indirect contact among individuals in a population, not the specific mother-to-child pathway during pregnancy, birth, or breastfeeding. This question tests disease transmission types, and one type comes up more than others: vertical transmission. A 2-month-old infant is diagnosed with an infectious disease, and the nurse suspects the infant got it from the mother during pregnancy or shortly after birth. The first transmission route to investigate is vertical transmission. Vertical transmission means disease passes from mother to infant during pregnancy, childbirth or breastfeeding. HIV, hepatitis B, and syphilis are classic examples. When an infant this young has an infection and the suspected source is the mother, vertical transmission is the starting point. Option A, airborne transmission, involves pathogens carried through the air. That's not the specific mother-to-infant pathway the question describes. Option B, fomite transmission, involves pathogens spread through contaminated objects or surfaces, not the mother-to-child route during pregnancy or birth. Option D, horizontal transmission, is person-to-person spread through direct or indirect contact among individuals in a population. It doesn't describe the specific mother-to-child pathway. Here's a WGU D450 OA exam tip for you: mother-to-infant during pregnancy, birth or breastfeeding. That's always vertical transmission. Quick recall hook: mother-to-baby equals vertical. 39. Tuberculosis screening at a federal correctional facility reveals that several inmates have positive skin tests. The nurse must determine the next clinical step to distinguish between those who are merely exposed and those who may have active disease requiring immediate treatment. What should the nurse do first? A. Begin antibiotic treatment immediately. B. Isolate all positive inmates together. C. Repeat the skin test next month. D. Refer positive inmates for chest x-rays. What do you think is the answer? Correct answer, D. Refer positive inmates for chest x-rays. Explanation: option D is correct because a positive tuberculosis skin test indicates exposure, but not necessarily active disease, and chest x-rays are needed to determine whether active tuberculosis is present and requires treatment. Option A is incorrect because beginning antibiotic treatment before confirming active disease through chest x-ray results is premature and could lead to unnecessary medication use for inmates who have latent rather than active infection. Option B is incorrect because isolating all positive inmates together without first determining who has active versus latent tuberculosis does not follow proper protocol and could expose latently infected inmates to those with active disease. Option C is incorrect because repeating the skin tests next month delays necessary diagnostic follow-up and does not help distinguish between active and latent tuberculosis, which requires chest X-ray imaging to determine disease status. This is a clinical application question about tuberculosis screening. Several inmates at a federal prison have positive TB skin tests. The nurse needs to figure out the next step. A positive skin test tells you the person was exposed to TB. It does not tell you they have active disease. To distinguish between latent exposure and active tuberculosis, you need a chest X-ray. That's the first clinical action. Option A says begin antibiotic treatment immediately. That's premature. You don't treat before confirming active disease. Some of these inmates may have latent infection that doesn't require the same treatment. Option B says isolate all positive inmates together. That's dangerous. If some have active TB and others only have latent infection, you're putting latent cases in a room with active ones. Option C says repeat the skin test next month. That delays necessary follow-up and doesn't help distinguish active from latent TB. You need imaging, not another skin test. Here's a WGU D450 OA exam tip for you. Positive TB skin test always leads to chest X-ray as the next step. The skin test shows exposure, the X-ray shows active disease. Quick recall hook, positive skin test, then chest X-ray. 40. A public health nurse is caring for a client diagnosed with gonorrhea who reports having multiple recent sexual partners. The nurse needs to address both the individual treatment and the broader public health concern of preventing further disease spread. Which action should the nurse prioritise? A. Instruct the client to notify sexual partners. B. Report the case to the employer. C. Recommend abstinence permanently. D. Prescribe additional antibiotics for partners. What do you think is the answer? Correct answer, A. Instruct the client to notify sexual partners. Explanation. Option A is correct because partner notification is the critical public health step to prevent further spread of gonorrhea, ensuring that sexual partners receive testing and treatment to break the chain of transmission. Option B is incorrect because reporting a sexually transmitted infection to the client's employer violates patient confidentiality and is not a recognised public health action for controlling gonorrhea transmission among sexual contacts. Option C is incorrect because recommending permanent abstinence is neither realistic nor the standard public health approach, and it does not address the immediate need to notify and test the client's current sexual partners. Option D is incorrect because the nurse cannot prescribe medications and should not provide antibiotics to individuals who have not been clinically evaluated, as partners need their own testing and provide a directed treatment plan. This question brings together individual treatment and public health responsibility. A client with gonorrhea reports having multiple recent sexual partners. The nurse needs to address the individual and the broader community concern. The priority action is instructing the client to notify sexual partners. Partner notification is the single most important public health step for STI control. It breaks the chain of transmission by making sure partners get tested and treated. Without it, the disease keeps spreading to people who don't know they're infected. Option B says report the case to the employer. That violates patient confidentiality. An STI diagnosis is never reported to an employer. Option C says recommend permanent abstinence. That's not realistic and doesn't address the immediate public health need of notifying current partners so they can be tested and treated now. Option D says prescribe additional antibiotics for partners. Nurses don't prescribe medications, and partners need their own clinical evaluation before treatment. You can't just hand out antibiotics to people who haven't been seen by a provider. Here's a WGU D450 OA exam tip for you. For any STI question involving multiple partners, partner notification is the priority public health action. Quick recall hook, STI plus multiple partners equals notify partners. 41. A city government allocates funding and passes an ordinance to build new walking trails throughout several neighbourhoods to encourage physical activity among residents. This change occurs at the organisational and policy level within the community. Which level of practice focus does this funding decision represent? A. Individual focused practice. B. Community focused practice. C. Systems focused practice. D. Population focused practice. Do you know the answer? Correct answer, C. Systems focused practice. Explanation. Option C is correct because systems focused practice involves changes in organisations, policies, laws and power structures within a community. And a city allocating funding through ordinance represents an organisational policy level change. Option A is incorrect because individual focused practice involves changing attitudes, knowledge, beliefs and behaviours of individuals, families and small groups, not passing governmental ordinances or allocating institutional funding for infrastructure. Option B is incorrect because community-focused practice involves changes in community norms, attitudes, awareness and behaviours, such as actually building the trails and shifting community activity patterns, not the funding decision itself. Option D is incorrect because population-focused practice is a broader nursing practice area that identifies problems through population-level assessment, not a specific level of practice focus describing organisational policy changes within a community. Alright, let's dig into the 3 levels of practice focus. This is a concept the exam loves to test using the walking trail example, so pay attention to how the same scenario plays out and across all 3 levels. The question describes a city government allocating funding and passing an ordinance to build walking trails in several neighbourhoods. That's a change happening at the organisational and policy level. That's systems-focused practice. Systems-focused practice involves changes in organisations, policies, laws and power structures within a community. When a city passes an ordinance and moves money around, that's a systems-level change. Option A, individual-focused practice, involves changing attitudes, knowledge and behaviours of individuals and families. Passing a city ordinance doesn't change a single person's behaviour. It changes the system. Option B, community-focused practice, involves changes in community norms, attitudes and behaviours. Actually building the trails and seeing the community start exercising is community-focused. The funding decision that makes it happen is systems-focused. Option D, population-focused practice, is a broader nursing practice area, not one of the 3 levels of practice focus. Different framework entirely. Here's a WGU D450 OA exam tip for you. When the action involves funding, ordinances, laws, or organisational policy changes, the answer is systems-focused practice. Quick recall hook. Policy and funding equals systems-focused. 42. After a community builds new walking trails, a nurse visits families in the neighbourhood to educate them about using the trails, helps them set personal exercise goals, and tracks their weekly physical activity to encourage behaviour change at the household level. Which practice focus level describes this work? A. Systems-focused practice. B. Individual-focused practice. C. Community-focused practice. D. Policy-focused practice. What do you think is the answer? This. Correct answer, B. Individual-focused practice. Explanation. Option B is correct because individual-focused practice involves changing attitudes, knowledge, beliefs, and behaviours of individuals, families, and small groups, which matches the nurse's household level, education, and behaviour tracking. Option A is incorrect because systems-focused practice involves changes in organisations, policies, laws, and power structures, not the direct education and personal goal-setting activities happening at the individual family and household level. Option C is incorrect because community-focused practice involves changes in community-wide norms, attitudes, and behaviours through environmental or social shifts, not the one-on-one family education and personal activity tracking described here. Option D is incorrect because policy-focused practice is not one of the 3 recognised levels of practice focus, which are specifically community-focused, systems-focused, and individual-focused practice within the public health framework. Now let's see the same walking trail scenario from the individual level. After the trails are built, a nurse visits families in the neighbourhood to educate them about using the trails, helps them set personal exercise goals, and tracks their weekly physical activity. The nurse is working one-on-one with families to change their behaviour. That's individual-focused practice. Individual-focused practice involves changing attitudes, knowledge, beliefs, and behaviours of individuals, families, and small groups. The nurse is in the household, teaching, setting goals, tracking activity, all at the personal level. Option A, systems-focused practice, involves organisational and policy changes. The nurse isn't changing any policy, she's working directly with families. Option C, community-focused practice, involves shifting community-wide norms and behaviours. The nurse isn't changing the entire community's culture, she's working with specific families one at a time. Option D, policy-focused practice, doesn't exist as one of the 3 recognised levels. The 3 levels are community-focused, systems-focused, and individual-focused. There is no 4th level. Here's a WGU D450 OA exam tip for you. When the nurse is educating specific families, setting personal goals, and tracking individual behaviour, that's individual-focused practice. Quick recall hook. One family at a time equals individual-focused. 43. A client recently diagnosed with high blood pressure tells the nurse that he does not believe the diagnosis is serious because he feels fine, sees no personal benefit in taking medication daily, and doubts that lifestyle changes will make any real difference to his long-term health. Which health behaviour model best explains why this client is unlikely to change? A. Social learning theory. B. Trans-theoretical model. C. Developmental theory. D. Health belief model. Do you know the answer? Correct answer, D. Health belief model. Explanation. Option D is correct because the health belief model focuses on internal beliefs as the primary motivator, and this client lacks belief in disease severity, perceived benefit of treatment, and confidence that change will help. Option A is incorrect because social learning theory centres on self-efficacy and learning through expectations and modelling behaviour of others, not on the specific internal belief components of perceived severity and perceived benefit described here. Option B is incorrect because the trans-theoretical model describes behaviour change as movement through sequential stages over time, rather than explaining how specific internal beliefs about severity and benefit prevent a client from changing. Option C is incorrect because developmental theory focuses on matching teaching approaches to the learner's developmental level, not on explaining how personal beliefs about disease seriousness and treatment benefit influence motivation to change. We saw the health belief model from the motivated side in question 22. Now let's see it from the opposite angle. When the beliefs are missing, this client was recently diagnosed with high blood pressure, but doesn't believe the diagnosis is serious, sees no personal benefit in medication, and doubts that lifestyle changes will make any difference. Every belief component is absent. No perceived severity, no perceived benefit, no confidence that change matters. The health belief model predicts exactly this outcome. When a person doesn't believe in the seriousness of the condition or the benefit of changing, they won't change. Option A, social learning theory, is about self-efficacy and modelling. The question doesn't mention peers, role models, or observing others. It's about internal beliefs. Option B, the trans-theoretical model, describes stages of change over time. The question doesn't describe a stage. It describes missing beliefs. Option C, developmental theory, focuses on teaching approaches matched to developmental level. That's not what this scenario is about. Here's a WGU D450 OA exam tip for you. The health belief model works both ways on the exam. When beliefs are present, the client is motivated. When beliefs are absent, the client won't change. Look for the keywords: believes, doesn't believe, perceives, or sees no benefit. Quick recall hook: missing beliefs equals no change equals health belief model. 44. A nurse observes that a healthy, middle-aged woman exercises regularly, eats a balanced diet, schedules annual wellness checkups, and avoids known environmental hazards because she understands how these actions protect her long-term well-being. Which category of health behaviour best describes this woman's actions? A. Preventive behaviour. B. Illness behaviour. C. Sick role behaviour. D. Adaptive behaviour. Can you guess the answer? Correct answer: A. Preventive behaviour. Explanation: option A is correct because preventive behaviour describes healthy individuals who are aware of how to stay healthy and actively take steps based on that knowledge, which directly matches this woman's proactive health-maintaining actions. Option B is incorrect because illness behaviour describes what people do when they are already sick, and this woman is currently healthy and acting to maintain her wellness rather than responding to an existing illness or symptoms. Option C is incorrect because sick role behaviour describes how people think about their life in terms of being sick, which can lead to poor decisions, and this healthy woman's not operating from a sickness identity or mindset. Option D is incorrect because adaptive behaviour is not one of the 3 recognised categories of health behaviour in the course material, which specifically identifies preventive behaviour, illness behaviour, and sick role behaviour as the key categories. This question tests the 3 categories of health behaviour, and it's more straightforward than it looks. A healthy middle-aged woman exercises regularly, eats a balanced diet, schedules annual wellness checkups, and avoids environmental hazards because she understands how these actions protect her long-term well-being. She's healthy and actively doing things to stay that way. That's preventive behaviour. Preventive behaviour describes healthy individuals who are aware of how to stay healthy and act on that knowledge. She knows what to do and she does it. Option B, illness behaviour, describes what people do when they are already sick. This woman isn't sick, she's maintaining wellness. Option C, sick role behaviour, describes how people think about their life in terms of being sick, which can lead to poor decisions. This woman isn't identifying with illness, she's actively preventing it. Option D, adaptive behaviour, is not one of the 3 recognised categories. The course identifies preventive behaviour, illness behaviour, and sick role behaviour. There is no 4th category. Here's a WGU D450 OA exam tip for you. Healthy person taking action to stay healthy equals preventive behaviour. Sick person responding to symptoms equals illness behaviour. Person defining their life by sickness equals sick role behaviour. Quick recall hook: healthy and acting on it equals preventive behaviour. 45. A community nurse working with a group of adolescents struggling with weight management pairs each teenager with a peer mentor who has successfully maintained a healthy weight. The teenagers begin to believe they can also succeed after seeing someone similar to them achieve the goal. Which learning theory drives this peer-based approach? A. Behavioural theory. B. Humanistic theory. C. Social learning theory. D. Critical theory. Do you know the answer? Correct answer: C. Social learning theory. Explanation: option C is correct because social learning theory emphasises that learning depends on expectations and self-efficacy, and seeing a similar peer succeed builds the belief that one can also achieve the same positive health outcome. Option A is incorrect because behavioural theory focuses on reinforcement driving learning through positive and negative consequences for behaviours, not on building self-efficacy through observing and modelling the success of similar peers. Option B is incorrect because humanistic theory emphasises emotions, relationships, and creating comfortable learning environments rather than the specific mechanism of building self-efficacy through peer modelling and observed success. Option D is incorrect because critical theory views learning as an ongoing, continuous process with no single endpoint, focusing on lifelong learning rather than the self-efficacy building that occurs through peer mentoring and modelling. This question brings us to social learning theory, and it's built around one specific mechanism: self-efficacy through peer modelling. A nurse pairs adolescents struggling with weight management with peer mentors who have successfully maintained a healthy weight. The teenagers start believing they can succeed after seeing someone similar to them achieve the goal. That's social learning theory. Social learning theory says learning depends on expectations and self-efficacy, the belief that you can or cannot succeed. When you watch someone like you do something successfully, your belief in your own ability goes up. That's the mechanism driving behaviour change here. Option A, behavioural theory, focuses on reinforcement, rewards and consequences. There's no reward system described. The change comes from watching a peer succeed. Option B, humanistic theory, emphasises emotions, relationships, and creating comfortable learning environments. That's about making people feel safe before teaching, not about building self-efficacy through modelling. Option D, critical theory, views learning as an ongoing, continuous process with no single endpoint. That's about lifelong learning, not peer modelling. Here's a WGU D450 OA exam tip for you. Peer mentoring, modelling, observing success in someone similar, and the phrase self-efficacy all point to social learning theory. Quick recall hook. Peer success builds belief equals social learning. 46. A hospital implements a new hand-washing compliance program in its long-term care unit to reduce hospital-acquired infections. After 6 months, the infection control nurse wants to determine whether the program actually worked. Which evaluation method best measures the program's effectiveness? A. Survey staff satisfaction with training. B. Observe hand-washing technique quality. C. Review attendance at education sessions. D. Compare infection rates before and after implementation. What do you think is the answer? Correct answer, D. Compare infection rates before and after implementation. Explanation. Option D is correct because comparing infection incidence rates before and after program implementation provides the most objective measurable evidence of whether the hand-washing program actually achieved its goal of reducing infections. Option A is incorrect because staff satisfaction with training measures how workers felt about the educational process, not whether the program actually reduced hospital-acquired infection rates, which is the intended health outcome. Option B is incorrect because observing hand-washing technique quality measures process compliance rather than the actual health outcome of infection reduction, which is the true measure of whether the program was effective. Option C is incorrect because reviewing attendance at education sessions tracks participation in the program rather than measuring whether the program achieved its intended outcome of actually reducing hospital-acquired infection rates. Program evaluation is one of the 5 most tested concept areas on this exam, so let's make sure this is locked in. A hospital implements a hand-washing compliance program in long-term care to reduce hospital-acquired infections. After 6 months, the infection control nurse wants to know if it actually worked. The best measure is comparing infection rates before and after implementation. That's outcome evaluation, OA, measuring the actual health result of the intervention. Did infections go down or not? That's the only question that matters when determining effectiveness. Option A says survey staff satisfaction with training. How staff feel about the training tells you nothing about whether infections decreased. Satisfaction is a process metric, not an outcome metric. Option B says observe hand washing technique quality. That measures whether people are doing the hand washing correctly, which is process compliance. Good technique doesn't automatically mean fewer infections. You need to measure infections directly. Option C says review attendance at education sessions. Attendance tracks participation. Full attendance and zero improvement in infection rates would mean the programme failed despite perfect turnout. Here's a WGU D450 OA exam tip for you. When a question asks whether a programme worked, the answer is always the one that compares actual health outcomes before and after. Satisfaction, attendance and technique are process measures, not outcome measures. Quick recall hook. Did the numbers change equals outcome evaluation? 47. A community nurse runs a 4-week diabetes education series and wants to know at the end whether the programme produced a measurable health improvement. She compares participants' fasting blood glucose averages from before the first class to readings taken after the final session and finds a 20% reduction. Which type of evaluation does this represent? A. Process evaluation. B. Summative evaluation. C. Formative evaluation. D. Structural evaluation. Can you guess the answer? Correct answer. B. Summative evaluation. Explanation option B is correct because summative evaluation occurs at the end of the learning process, wraps up all learning, and summarises outcomes, which matches this end-of-programme comparison of health data, showing measurable improvement. Option A is incorrect because process evaluation is ongoing continuous monitoring throughout a programme to determine whether objectives and goals are being met in real time, not a final end-of-programme outcome measurement. Option C is incorrect because formative evaluation happens partway through the learning period to identify needed adjustments and check progress, not at the conclusion of the entire programme to measure final health outcomes. Option D is incorrect because structural evaluation is not one of the recognised evaluation types in the course material, which identifies process evaluation, formative evaluation, and summative evaluation as the standard assessment categories. This question reinforces the distinction between evaluation types by presenting summative evaluation in a concrete scenario. A nurse runs a 4-week diabetes education series and compares fasting blood glucose averages from before the first class to readings after the final session. She finds a 20% reduction. The evaluation happened at the end. It wraps up all learning. It summarises what occurred throughout the programme. That's summative evaluation. Think of summative as the summary. It comes at the finish line. Option A, process evaluation, is ongoing continuous monitoring throughout the programme. It asks whether objectives are being met in real time, not at the conclusion. Option C, formative evaluation, happens partway through, like a midterm. It checks progress and identifies adjustments needed before the programme ends. This evaluation happened after everything was done. Option D, structural evaluation, doesn't exist in the course material. The recognised types are process, formative, and summative. If an answer option names an evaluation type you haven't studied, it's probably made up. Here's a WGU D450 OA exam tip for you. End of programme plus final results equals summative. During the programme plus checking progress equals formative. Throughout the programme plus continuous monitoring equals process. Quick recall hook, final summary equals summative. 48. A home health nurse visits an elderly client and notices the client appears unsteady, clutches furniture while walking, and refuses offers of physical assistance despite visible difficulty maintaining balance. Which nursing action should the nurse prioritise first in this situation? A. Identify safety hazards in the home. B. Recommend a physical therapy referral. C. Schedule a follow-up visit next week. D. Contact the physician about medications. Correct. Do you know the answer? Correct answer. A. Identify safety hazards in the home. Explanation. Option A is correct because when an elderly patient shows instability and full risk, the nurse's first priority is identifying potential safety hazards in the home, like clutter, slippery floors, and inadequate lighting. Option B is incorrect because while a physical therapy referral may be appropriate later, the immediate priority is assessing the home environment for hazards that could cause a fall before the client can access therapy services. Option C is incorrect because scheduling a follow-up visit next week delays intervention for an immediate safety concern, and the nurse should address the current fall risk by assessing the home environment during this present visit. Option D is incorrect because contacting the physician about medications may be warranted if medications contribute to unsteadiness, but the immediate nursing priority is environmental safety assessment to prevent an imminent fall. This is a clinical application question about home health, and it tests nursing priority. A home health nurse visits an elderly client who appears unsteady, clutches furniture while walking, and refuses physical assistance despite visible difficulty with balance. The nurse needs to act. The first priority is identifying safety hazards in the home. When an elderly patient shows full risk, the immediate concern is the environment they're living in. Clutter on the floor, slippery surfaces, poor lighting, loose rugs, unstable furniture. Any of these could cause a fall right now. Environmental modification is the priority before anything else. Option B says recommend a physical therapy referral. That may be appropriate later, but the client needs to survive the home environment safely first. A referral takes time. The hazards are present right now. Option C says schedule a follow-up visit next week. That delays action on an immediate safety concern. The nurse is already in the home. Assess the environment now, not later. Option D says contact the physician about medications. Medications may be contributing to the unsteadiness, and that's worth investigating. But the immediate priority is the physical space where this client could fall and break a hip today. Here's a WGU D450 OA exam tip for you. For elderly fall risk in a home setting, environmental safety assessment always comes first. Quick recall hook, Fall risk at home equals check the environment first. 49. A school nurse evaluates the results of a bicycle safety education program that was delivered to elementary students at the beginning of the school year. The nurse wants to know if the program reduced actual injuries. Which data comparison provides the most objective measure of program success? A. Survey students about helmet attitudes. B. Count helmets observed in the bike rack. C. Compare bicycle injury rates before and after the program. D. Interview parents about safety awareness. Do you know the answer? Correct answer, C. Compare bicycle injury rates before and after the program. Explanation. Option C is correct because directly comparing the incidence of bicycle injuries at the beginning and end of the program provides the most objective measurable evidence of whether the education actually reduced injuries. Option A is incorrect because surveying student attitudes about helmets measures knowledge and belief changes rather than the actual health outcome of reduced bicycle injuries, which is the program's intended measurable goal. Option B is incorrect because counting helmets in the bike rack measures a behavioural proxy rather than the actual outcome of injury reduction. And helmet presence does not directly confirm that injuries decreased in the population. Option D is incorrect because interviewing parents about safety awareness gathers subjective qualitative data about knowledge rather than the objective quantitative injury rate data needed to determine whether the program actually worked. This question revisits program evaluation in a school nursing context. A school nurse delivered a bicycle safety education program to elementary students at the start of the school year. Now she wants to know if it reduced actual injuries. The most objective measure is comparing bicycle injury rates before and after the program. That's a direct outcome comparison. Did the number of injuries go down? If yes, the program worked. If not, it didn't. No subjective interpretation needed. Option A says survey students about helmet attitudes. That measures attitude changes. What students think and feel about helmets. Attitudes aren't outcomes. A student can have a great attitude about helmets and still get injured. Option B says count helmets in the bike rack. That's a behavioural proxy. More helmets is encouraging, but it doesn't directly measure whether injuries went down. A kid can wear a helmet and still crash. Option D says interview parents about safety awareness. That's qualitative, subjective data about knowledge and awareness. What parents know about safety doesn't equal fewer injuries in children. Here's a WGU D450 OA exam tip for you. Whenever the question asks for the most objective measure of program success, look for the answer that directly compares the actual outcome. In this case, injury rates before and after. Quick recall hook. Actual injury rates before and after equals most objective. 50. A community nurse assesses a neighbourhood and finds the average family income is adequate, but the range between the lowest and highest earners is very wide. The nurse suspects this average may be hiding significant economic disparities among residents. Which additional information does the nurse need most to identify hidden, vulnerable subpopulations? A. The total number of families surveyed. B. The average housing cost in the area. C. Employment rates by industry sector. D. Frequency of incomes above and below the average. Can you guess the answer? Correct answer, D. Frequency of incomes above and below the average. Explanation. Option D is correct because understanding the distribution of incomes above and below the average reveals whether a large subpopulation earns far less than the average suggests, identifying hidden vulnerable groups needing targeted interventions. Option A is incorrect because the total number of families surveyed tells the nurse about sample size but does not reveal how incomes are distributed across the population or whether significant disparities exist among different groups. Option B is incorrect because average housing cost provides context about affordability but does not directly show how income is distributed among families or identify which subpopulations may be earning far below the community average. Option C is incorrect because employment rates by industry sector provide economic context about the job market, but do not directly reveal the income distribution pattern needed to identify hidden, economically vulnerable subpopulations. Let's close out with a community assessment concept that tests whether you understand what averages can hide. A nurse assesses a neighbourhood and finds the average family income is adequate, but the range between the lowest and highest earners is very wide. The nurse suspects the average may be hiding significant economic disparities. The additional information she needs most is the frequency of incomes above and below the average. An average can be misleading. If 10 families earn $30,000 and 2 families earn $500,000, the average looks fine, but most families are struggling. Knowing the distribution, how many families fall above versus below the average, reveals whether a large chunk of the population is actually far worse off than the number suggests. Option A says the total number of families surveyed. That tells you sample size, but nothing about how income is spread across the population. Option B says average housing cost. That's useful context about affordability, but doesn't show the income distribution pattern. Option C says employment rates by industry sector. That tells you about the job market, but not about who's earning what within the community. Here's a WGU D450 OA exam tip for you. When a question describes an average with a wide range and asks what's missing, the answer is income distribution. Frequency above and below, averages hide disparities. Quick recall hook. Wide range plus average equals need the distribution. You have reached the end of our first question set. For the free complete exam preparation, visit our website link in the description, where you find thousands more practice questions and comprehensive study guides. Thanks for studying with us today. See you in the next video.